Mr. Burns, how are you doing today? Awesome. My name's Emily. I'm a student nurse at the University of Memphis, and I'll be taking care of you today. Can I verify your name and date of birth on your wrist, please? Awesome. Thank you. Awesome. Thank you so much. All right. So we have an order today to put in a urinary catheter because of your urinary retention. So that just means I'm going to be inserting a tube into your bladder that will drain your urine out for you because you can't get it out on your own, okay? All right, awesome. So we're just going to get started then. Hopefully get this over with really quickly. So I know it can be a little uncomfortable. Okay, so I'm just going to start. I'm going to close the curtain here. And I'm going to raise the bed up to my waist. And then I'm going to move the side rails down so I can have better access, okay? All right, awesome. So I'm just going to put some gloves on. All right. And then I'm going to move your blanket down. We're going to move your blanket down, okay? All right. And now I'm just going to position you, okay? I'm going to move your gown up to expose you, okay? All right. So here's the kit. We're just going to get started, okay? I'm going to take the kit out. Set it over here. And I'm just going to turn this into a little trash bag really quick. Alright, and I'm just going to start opening the kit. I'm going to touch only the corners, just to keep it sterile, okay? Alright. Open this here. And open this. Alright. Now I'm going to take these gloves off. I don't need them anymore. Do some hand hygiene again. I'll let them air dry for a second. It's hard to put gloves on wet hands. Okay. And now I'm going to take the gloves and put them on. And on the first glove, I will only touch the inside. This is the one I always struggle with, so hopefully this goes on a little bit easier this time. Alright. Alright, and I'll adjust that when I get this next one on. Now I'm only going to touch the outside of this one with this sterile glove. Alright, now I can adjust my fingers. Alright. Getting them on. Have you ever had a catheter before? Alright, so this will be a breeze. Alright, I'm just going to pick this up. I'm going to set it to the side. And I'll pick it up later. Alright, just going to move this up just a little bit. And now I'm going to take this drape. I'm going to drape it beneath you. Alright, drape it beneath you. There we go. I'm going to move this because I'm not going to use this. Move this up a little bit and take this out. I'm going to open up these swabs and I'm going to pull them out a little bit so they're easy access when I pull them later. Alright, I'm going to open up this lube. Alright, awesome. And I'm going to open up and take the lid off of this syringe, and now I'm going to take the catheter. Usually there's a wrapper on this catheter, but there's not today. So I take the lube, make sure it's open, good. And now I'm going to insert the catheter without touching it if I can. Here we go, it's in the lube. Alright. And now I'm going to take the syringe and plug it into the bifurcation, just so everything's ready to go. Alright, now I'm going to clean it, okay? Let's begin. I'm going to grab my first swab. I'm going to grab, and then I'm going to go around the urinary meatus. 1, 2, 3 times. Awesome. And now I'm going to take the catheter, I'm going to flop the lube off, and kind of pull everything out, and I'm going to insert it all the way to the bifurcation. And I see urine return. I'm going to hold it, I'm going to insert 5 milliliters of sterile water into that balloon. Alright, we are pretty much done, but let's just keep it all clear. Alright, tug, and it tugs good. Alright, and I'm just going to attach it to your leg, and I'm just going to hang the catheter below your bladder so that it drains your urine. Okay, awesome. Today we inserted a fully urinary catheter, 16 French, into Mr. Burns. I saw clear yellow urine. I inserted 5 milliliters of clean sterile water into the bladder, and Mr. Burns seems to have responded very well.